Welcome back to the podcast, everybody. So you've done the rounds, 2, maybe 3, maybe more rounds of antidepressants, years of talk therapy that feels like you're just circling the same drain. You've been given a label, treatment resistant. Now what? It can sound like a life sentence to many people, and it sounds like you're the problem. But what if I told you treatment was resistant to you, not the other way around? So we'll dive into that a little bit today. You've got to keep your ears open, your eyes open, and really dig deep when it comes to trying to understand treatment-resistant depression. Because what if your depression isn't a broken brain, but a signal from your soul that's simply been unheard for too long? So welcome to the Center for Healing and Life Transformations podcast. Today we're breaking the silence on TRD, treatment-resistant depression. This isn't just a clinical discussion, not at all. It's another kind of holistic discussion, a very important one that we need because we need perspectives from all different types of camps, not just the psychiatric community. We're not just going to settle with you can't get the right set of meds going. You're going to have to go and get electric shock therapy or whatever it might be. No, it's a far, far bigger subject. And today we're breaking the silence on it. So it's a roadmap back to life that we're all looking for when we want to understand TRD. So I'm your host, and today we're going into the 30%, the millions of people, the standard model of people that are left behind when it comes to finding a cure or an elixir or a treatment for TRD, which we're going to call it for short today, okay? So the traditional psychiatric model only treats about a quarter of the problem, and I'm all for the psychiatric model. It's definitely got its place today. So that psychiatric model is the biology, and treating TRD with only a pill is like trying to fix a car with a flat tire, a broken engine, and a driver who has lost their map, but only choosing to pump air into the tire, not attending to the rest of it. Okay, it's not just serotonin, it's gut health, it's inflammation. This is what the science is starting to say. So that's the body. The heart is all about processing the unprocessed. Trauma and grief play a role in depression. You know, it's where the pain is where our cures are going to be found most of the time. The mind is about rewiring the literal tracks in your brain, those grooves in your head. Your neurobiology plays a big role, and how you've thought, felt, acted, and reacted. Every attitude, consequence, every event and situation you've experienced in your life, and how you've reacted and believed and processed those events are how your brain is wired, and you develop a personality. So finding the vitality again will take us looking into the persona meaning the masks that we wear. Healing this deep takes a village. That's important. But not just any village. It takes a bunch of perspectives. It takes a bunch of good people. And it takes you and a journal. So what I suggest is you write everything down and you start developing a picture for yourself. Because so many people that I treat 24 years in to coaching and healing, and 15 years into running the Center for Healing and Life Transformation, I can tell you that the prison and the cage that people find themselves in often is almost unbearable to them. And it's big business to try and get them out of it, because It's just their lives we're talking about here, you know. Their dads, moms, their sons and daughters who can't get their careers going because of this issue, and their lives are on total hold until they find solutions, which is what we want to try and do here today. But I want you to know this. You don't have to live with depression forever. You just need a different approach. You know, what hasn't been working is only half the story. So I want to go in now to a couple of things that do work, a couple of ways that you can treat depression, because that's the biggest thing that people want to find out is, okay, how do I turn this around? And I want to go and deep dive into those ways now. And let's find out about 10 different life-changing treatments for depression. So TRD has standard treatments. Those are going to a psychiatrist, getting a set of meds, testing them out for 2 weeks, 4 weeks, 6 weeks, and then going back and making tweaks. So we know that one. And, a standard treatment would also be, along with the medication, implementing lifestyle changes, going for your exercise, your diet. You've got to improve your sleep. That's huge. You have to sleep. So, I always say to people, if they're not sleeping, I say to them, get to the center. No, I haven't slept for years, Mark. People sleep in the first week, and I say to them, you can't get better without sleep, routine, So it all highlights the importance of trying different types of therapy along with medication. Okay, so then the second way, that's the standard way. The second way is when treatments prove ineffective. You're just getting nowhere with psychological testing, with the doctors, with intensive therapy programs and medication changes. Then it's sometimes time for some people to go to a hospital, to go to an intensive outpatient program or a residential treatment center if you have any, or a wellness center like ours, and you start to change everything. In other words, you hit it from every single angle and look for solutions. And that's normally a very, very good second way to dive deeper into finding a cure for this thing, a solution, an elixir. Okay, so that's another way, is packing your bags and getting going and going into something slightly more intensive than being at home. Another way is electroconvulsive therapy. It scares a lot of people, and it should, because it's got a bad rep, and it should. But today it's got a far, far better reputation. They use anesthesia today. They use mild shocks, different kinds of shocks. They know what's going on if you get the right person. And, the side effects are temporary memory loss, and it can be traumatic. But that really is a last resort for most people, and it's something, obviously, you've got to go and discuss with the doctor or two, and then get another opinion before you start. Because often people jump into it unnecessarily and suffer those side effects that they didn't have to. Another big one today is ketamine, used as a fast-acting treatment for depression and definitely suicidal ideation. That's something that's normally administered in an IV or through a nasal spray. And we've seen very good results with ketamine. People who have stuck with it, normally starts with 6 sessions with a good doctor, anesthetist, and you stick with it, you open your heart, you go and prep yourself. That's very, very important. Before you go, you don't just walk in and be closed. Deeply press down into your issues. You have to prep for ketamine, that's for sure. So they use that fast-acting treatment. You go in for your sessions, and hopefully it takes you across that rainbow bridge from that feeling of being stuck or powerless to one where you can open your EQ again, start to feel, move beyond the numbness, and, sort of get your life back on track that way. The EQ is always in the middle of any process, and I like ketamine for that reason, because it seems to open those heart centers. And, whether it's chakras or whatever model you go for, you must understand that you got to go from the basement to the penthouse. And please look up the energetic scale of consciousness, or ESC. And it's a way we map out exactly to a point between 0 and 1,000. We map out exactly where people are on that scale. So if they're operating at 241, we put them in a process and we want to get to 500, 600, 700. And it's a map, it's a way shower. It's amazing when people can see where they've been, where they are now with treatment-resistant depression, anxiety, anything. It's so amazing to show them the way forward. And when we give them their questionnaire responses, it's an 80-point questionnaire, there's a sense of relief often, because it's so comprehensive. They can actually see the feelings and say, that's me. They can see the symptoms of closedness and relate. So it's a really good tool. But ketamine also sometimes does nothing, and people need to know that. Sometimes it's just not the right way to go, and it's always something you can circle back to again in the future. But there are no quick fixes. So people who are going for a quick fix, ketamine's not your route. It's not going to be. So, I've seen the good and the bad, and definitely think it's a great tool, because I've seen it work for some people. And with therapy, all of these are with therapy. Can't escape the therapeutic side of what needs to happen with treatment-resistant depression. You've got to do therapy, because life is about learning, growth, contribution. It's about going from something small to something bigger, and it's about elevating your consciousness. Depression is rooted there. If you deeply press down, you're stuck. And why are you stuck? Because you can't spiral upward. So that's what you need to do, and therapies can be your way to do that. Do it online. Don't say, I've tried therapy, it hasn't worked for me. That's not going to happen. You got to go to someone else. Get online with us, with someone, and be in a process. Do some work. And even if you're not going to feel like it, it'll go along with things like ketamine therapy. So today we've got things like psilocybin. It's another big one that's proving to have some very good results. Really opens people up. It lasts long. It can be that rainbow bridge I call moving, that snap that you're looking for to move from hopelessness to hope. So the psilocybin is great, probably illegal in most places. So yeah, it just depends on what your doctor says again. The psilocybin is something that's going to be around for a while. It's probably the one with the best results that we're seeing in communities today. So it's a big one. Vagus nerve stimulation, also huge. We see people with vagus nerve shutdown. They play possum. They can't move. Their bodies have said no more stress. And it's a really good one to, it involves stimulating that vagus nerve through a surgically implanted device or something that is used to regulate your emotional responses, again, your EQ, and get you from your IQ, that analytical negative mind, to your, what I call your contemplative mind, in your prefrontal cortex, which is where pleasure is, joy is, creativity is. So you're moving from that spine part of your brain, that basement to the prefrontal cortex that is protected by your forehead. And things like vagus nerve stimulation, or VNS, are going to help with that. You get fecal implants to change your microbiome. You get SGB, which is stellate ganglion block. It's another anesthetic injection, also in the back of the neck there. That's being explored for things like trauma and major anxiety. But again, you've got to do the therapy first on these things before you go and do them, because they are more extreme than most people would like. So we get metabolic treatments, ketogenic diets, things focusing on the gut, that mind, body, heart connection and coherence is important. So there's a lot of those metabolic treatments coming up. And then we get things like ice baths, cold water plunges. People have to get up, get a routine, splash their face, go in a cold shower for 30 seconds. They don't just have to throw you in an ice bath. So there's ways of changing that mental state. And Wim Hof is a great one to look at when looking at ice baths, or what is clinically known as cold water immersions. It helped him with severe depression, and it's helped many, many thousands. And old Wim Hof, when his wife died, she committed suicide. He was severely depressed and found literally by accident that going into the ice stopped his negative thinking. It stopped the ants from eating his brain. Ants being automatic negative thoughts, which are huge when it comes to treatment-resistant depression. So the question is, how lifestyle interventions help with TRD are very, very important. How therapy helps is very, very important. Do we do things like psilocybin, the fecal implants, the ketamine, or the TMS? Yes, go and see your doctor for it. Go. But remember what life is about. Remember the journey that you're on. And understand that you're here to grow, heal, and recover. And most importantly, this too shall pass. I'm actually going to say that again. This too shall pass. You must understand that this is impermanent, and it's hard to remember that sometimes when things are going south with treatment-resistant depression. So if you're listening to this from a dark room or a dark cloud, or from a life that feels like a shadow of what it used to be, stop managing your expectations. Start managing your transformation. We've seen it here at the center for 6 to 12 weeks, and that's the window we ask for you to rewrite a decade of pain, if that's what it's been. Never give up, never give in. There's an immersive treatment landscape out there. You've got this. Thank you.